Good morning, good afternoon, or good evening, one and all, wherever you are in the world. My name is Sarah Ahmed Hassoun Al Sayed. I'm a veterinary surgeon by training, a PhD alumni from the University of Cambridge in the UK, an associate fellow of the Higher Education Academy, and a Newnham College associate. Through this series of videos, we will be navigating veterinary orthopedic, starting today with the diagnosis of lameness or the framework of the diagnosis of lameness. So let me share my screen so we can start our talk. All right. So the topic of today is introduction to lameness and lameness diagnosis. By the end of this session, you should be able to define lameness, understand the main objectives of lameness diagnosis, put a comprehensive clinical diagnostic plan for lameness cases or orthopedic cases in general, identify the cause and the signs of lameness that can be reported while the animal is in a standing still position. In the following session, we will be talking about animals in motion and a gait analysis, either subjective or objective, and an instrumented gait analysis. We also will be talking further on in other videos about the orthopedic exams in different species, particularly horse and dogs, and as well as special diagnostic tools like a diagnostic anesthesia or a diagnostic imaging. So to begin with, what is lameness? What is the definition of lameness? So it's a sign, it's a manifestation rather than a disease by itself. So lameness, simply put, is an abnormal gait or stance in an animal or human beings. Human beings are animals themselves. That is a result of a dysfunction of the locomotor or the musculoskeletal system. Lameness is simply a manifestation of pain or other mechanical defects in the body, indicating a structural or function disorder in one or more limbs, or also maybe also in the spine or the back. So when we say the word lameness, what animal species comes to your mind first? My guess is probably horse or equine, for the obvious reason, because equine and horse is predominantly very dependent in their musculoskeletal system. Their function, either as a riding horse, racing horse, working horse, or even just as a pet, relies on the musculoskeletal system. However, as it's a very obvious statement, of course, it can happen in any other species and human beings as well. It's not only restricted to horses. So what would be your aim while diagnosing a case of lameness or an animal with lameness? The objectives of lameness diagnosis, in other words. Firstly, to identify, is it really a lameness, or is it, or it's an abnormal gait as a result of, for instance, colic or inguinal hernia? To identify which limb or limbs are involved, either it's one limb, right, or more than one of them. After identifying which limb is problematic, identify actually the site of the problem, which area, which joint, which structure is causing the problem. Also, identify the cause of the potential problem, predict the prognosis, offer appropriate treatment, and offer a clinical service. So simply put, to know, is it really a lameness? Which limb? Where is the site of lameness? So, and if it's, for instance, in the deep digital, for example, tendon, so what cause of this potential problem? Identifying the area, we aim to identify the cause, predict the prognosis, and offer appropriate treatment. The steps, the SOP of lameness diagnosis. What is the plan, the structure we will follow when diagnosing lameness case? First of all, get the case history, followed by a visual assessment, and gait analysis. The visual assessment at rest and during motion alike. Put your hand on animal and palpate different areas, and manipulation and flexion test, flex and extend. The palpation and manipulation test can be put together as perform a proper orthopedic exam. Then another layer of diagnosis is using diagnostic anesthesia and diagnostic imaging and laboratory tests as well. Starting with the case history. So what questions do you think you should ask an owner while collecting a case history if animal came to your clinic with signs of lameness as a complaint? So these are the questions I would ask. The duration of lameness, how long has the animal been lame? Is it 1 week, 2 weeks, a year, to know is it acute or chronic, basically? The character of lameness, is it progressive or sudden? Does it increase or decrease with exercise? Is it an intermittent or a continuous pattern? What time of day? First thing in the morning, late in the evening? All these questions helpful to suggest one diagnosis or another. Suspected cause, actually asks the owner, do you think there is any suspected cause or anything that happened recently that you suspect caused this lameness? For instance, any history of accident or trauma? Is the horse shoed recently? If the animal is a horse, has been shoed recently, etc. And ask them when they notice the lameness. Did they notice the lameness when the animal start moving, or at rest, or both of them? Any previous treatment, and did it help at all? Another important question, what is the purpose of owning this animal? What's this animal's job? If it's a horse, for instance, is it a racing horse? Is it a pet horse? Or is it a working drafting horse? If it's a dog, is it a pet dog? Is it a herding dog, guard dog, or a service dog? Each kind of job of the animal comes with more predisposition to certain injuries, to phrase it like that. Besides the lameness, is there any other associated symptoms like fever, for instance, indicate infection of some sort? And if we talk about fever, lameness, the person pops stomatitis, Lyme disease, tick-borne disease. Does animal stumble while it's walk? Is it a quote unquote clumsy animal, or just a lame animal? Because it's also suggestive to other specific injuries and diseases. And there are many other possible questions that can be added to this list of questions to collect a case history. I would say also, take your case history with a pinch of salt. Not all owners know exactly what happened or even the history of their animal. So collect as much information as possible, but bear in mind it might be 80% accurate, 20% inaccurate. So take it with a pinch of salt, as they say. Starting with the visual assessment at rest while the animal is standing still. So before bombarding you with abnormally looking animal, we have to familiarize our eyes versus what normal looks like. This is what normal looks like in equine, in bovine, or in cattle as an adult, and also juvenile calves. Dogs, of course, dogs come in different breeds, all shapes and sizes. So what's normal for a Belgian Malinois is very different from what looks normal for a Dachshund or a Corgi. So not only species, breed variation plays an important role of what normal conformation looks like in dogs. Same applies to cats. Long story short, what makes this pattern, either in horse, cattle, dogs, or cats, labeled as musculoskeletally normal? The key word is symmetry. There is no difference between one side or another. Animal standing on the ground with off puts or paws on the floor. There is no grimace facial manifestation of pain. So that's why it's labeled as normal. Moving to some conditions, diseases, or injuries that doesn't even need us to walk the animal or palpate the area to see that it's a problematic. So it's diagnosis of lameness or abnormal manifestation of the musculoskeletal system that can be diagnosed while the animal is standing still. First thing, if an animal is non-weight bearing in one leg or another, we call it carrying a leg or a dead degree of lameness. Here, for instance, it's a left front limb. Here it is a left hind limb in a horse. Let's watch this short video of a donkey with a fracture, very bad fracture actually in the left front leg. So it's very obvious as a daylight, as they say. It doesn't need examination to say, oh, the problem is in the elbow, around the elbow area, most likely a fracture on the left forelimb in the donkey. Also in these puppies, in these foals, in these puppies, in these dogs, this dog right here, the pit bull in the middle, carrying its left-right bow. Here it's left right front paw for the poorly conditioned dog in here. What's wrong with Labrador there? We can't really say from this picture, but if the animal just sitting all the time, refuses to move, that suggests a problem in its hind legs. I would say most likely, based on how it's sitting, it's left hind leg because it's avoiding putting any weight on it. So here, and in this kitty, we can see that the right front limb is problematic in here. Same for this little calf, it's a right front limb. So the animal is not putting any weight or non-weight bearing or dead degree of lameness as a result of a fracture or dislocation or a very bad injury is in there. So it doesn't need any further investigation to identify basically which limb is a problematic one. That not, especially in horses, that not to be confused with this. This is a normal behavior called resting leg or leg resting in horse. It's usually shifting from one limb to another every 20 minutes. So it's an acquired normal behavior. If it's shifting, it's normal. But if it's holding it up all the time, it's an indication of a problem in this limb. Another very obvious manifestation that doesn't need universal investigation to say, aha, this is the problem, is knuckling over. This is knuckling over, which is mean the hyperflexion at the level of the flexor tendon or at some one level or another in the limb. So it's hyperflexion of the joints. Here in the left hind and here in both of the front limb of this foal. Usually, what leads to there are multiple reasons or causes that lead to knuckling over, but it's due to short flexor tendon, either as a congenital anomaly, as most susceptible if it's a fully young animal like that, or a secondary complication to a chronic tendinitis or a chronic inflammation in the structure lead to fibrosis and contraction of these tendons, leading to knuckling over. And its most common reason, the chronicity given in adult animal, while the congenital malformation or congenital anomaly are more predominant, of course, or seen in young animals. Again, another form of this knuckling over can be seen in dogs and cats. Actually, speaking of knuckling over, there is variable degree. In the previous slide, we can see knuckling over only at the level of the headlock. It's or the end of the digit, the proximal interphalangeal joint. While it can be severe enough to be even knuckling over the carcass of the animal, the carbi of the animal. So depending where is the level of the problem in there, either it's congenital or acquired, see where the knuckling over start higher up the leg, which most likely can be over the carpus or at the level of the digits or the interpharyngeal joint. The at the level of the fetlock or the interpharyngeal joint are most commonly seen in equine and cattle, while the more severe degrees or higher up in the leg, mostly seen in dogs. It doesn't prevent, it also can be seen in farm animals as well. All right. And it's another knuckling over in the calf. Long story short, that says it can be presented in different spaces. An opposite of knuckling over is the hyperextension. And instead of hyperflexion, which is the knuckling over, it's hyperextension. We mentioned that the knuckling over due to short flexor tendon at the back of the leg, while hyperextension, it can be either short extensor tendon or a very long flexor tendon. So flexor tendon laxity or abnormally long, it's a congenital anomaly of the flexor tendon. So it's hyperextending, there's an imbalance in there, or it's acquired as a result of flexor tendon rupture or severing. Hyperextension can also be seen at the level of the stifle joint, which is an indication of a very common clinical presentation or disease or orthopedic disease, which is the upward patellar fixation, usually seen in equine and cattle. So hyperextension at the level of the stifle joint or the knee joint is a very characteristic sign of upward patellar fixation or locked knee or locked stifle. Another very characteristic stance, usually seen in horses, or it's only mostly seen in horses, is the wooden horse-like stance, not to be confused with tetanus. This specific stance, like a toy wooden horse, with the forelimb extended forward and the hind limb underneath the abdomen, is characteristic for laminitis. Laminitis, seen also. Laminitis can happen in cattle as well as horses, but it's most commonly presented in equine. Other abnormalities can be seen in a standing position, starting from the hoof or the bow up to the shoulder or up to the pelvis in the hind limb. And for the forelimb, the abnormal angle of the foot or of the hoof. So if it's tilted outside, it's called pronation. It's a pronated hoof. If it's tilted inside or the angulation is abnormally inside, is called spronation. So pronation versus spronation. It's also very common in the human being. There is imbalance, or the foot is inclined toward what medially or laterally. If it's medially, it's pronation. If it's laterally, it's spronation. Very narrow, upright looking foot, it's called a club foot or a club hoof in horse. The opposite of club foot is flared, very flat, like flat foot in human being. It's very flared, it's called flat foot. Another obvious thing that we can see, if there is a crack in the hoof, we can miss it. There is a crack in there, very obvious. Or if there is a swelling at the level of the interpharyngeal joint, the proximal or distal interpharyngeal joint. Sometimes with a compensatory flare suits as well. Another thing that you can't miss, if there is an obvious injury, sorry for the gory image, this poor horse came to the veterinary hospital with injury all over its pastern area. So this horse was tied with a rope by its foot, and it was trying to run away. So it's kind of scalded and irritated this entire area of the foot. So long story short, if you see this, you cannot unsee it or miss it. It's obvious that this injury, this wound, is the site of the problem. Moving a little bit up at the level of the forearm, or the Shannon bone, oh sorry, forearm at the metacarpal or metatarsal bone level, let's phrase it like that, moving from the hoof to the interpharyngeal joint, and a little bit up toward the metacarpal or metatarsal bone, we can see this what's called bone tendon as a result of acute tendinitis. So at the back of the limb there is the flexor tendon apparatus, the superficial, the suspensory ligament, and the flexor tendons back there. And when there is a tendinitis or tenosynovitis, we can see this swelling there. It's called bowed tendon. At the level of the metatarsal or metacarpal, something very important and very common to see, particularly in pet animals like dogs, or mostly chondrodystrophic dogs. It can happen actually in any breed, but mostly seen in chondrodystrophic dogs like Dachshund or Basset Hounds, for instance. It's the angular land deformity. So the normal, there is a straight line between the shoulder and the paw, while if there is a angulation inward, it's valgus, and it's outward, it's varus. In other words, if the angle toward the lateral side, lateral, it's valgus. If it's internally toward the medial side, it's varus. So this is valgus in a dachshund or a wiener doggo, and this is varus here in this little puppy, and this is valgus in a horse and varus in a horse. So it can happen in any species, actually, the angular limb deformity, but it's mostly presented in a pet animal or small animal clinic. Up from the metacarpal to around the carpal joint, we can see what's called a hygroma of the carpals or a cadney as a result of the pericarpal bursitis, inflammation of the bursa in front of the carpal joint. But move a little bit more up towards the elbow joint instead of the hygroma of the knee. Now the bursa in here, which is the olecranon bursa, we call it calved elbow or olecranon bursitis, can be seen in horses, can be seen in cattle, or in dogs as well. Another very characteristic manifestation that can be seen in the animal in a standing position, even without moving it, is the radial nerve paralysis. Radial nerve paralysis has a characteristic dragging a leg. The leg is flaccid and dragged in there, mostly a little bit elongated more than the other leg, and with a loss of the muscle tone. So this is a characteristic of the radial nerve paralysis. Around the shoulder area, either we can see multiple abnormalities, but either it's atrophied with the scapular spine very prominent in there, or it can be swollen. In other words, if there is any asymmetry in form of atrophy, which is an indication of chronic pathology or chronic injury, or in form of swelling, is an indication of acute trauma mostly, or even fracture or dislocation. Sorry, or dislocation. This is a very characteristic image of a dislocation or a dislocated shoulder. The shoulder is out of its, so the humerus is out of its socket. So you can see it's swollen, it's moved away. It is a quote unquote abducted from the medial line of the body. In this case, the dislocation is cranially. The humerus moved cranially. For the hind limb, we mentioned that the hyperextension is a very characteristic to the upward lateral fixation, swelling around the hock joint or the tarsal joint, we call it spavin. There is two types of spavin. There is a pony spavin and there is a box spavin. The swelling most commonly seen in the box spavin or the fluidy spavin. We said the bursitis or inflammation of the bursa around the corpus, we call it hygroma of the knee. In the elbow, it's capped elbow. And here in the hock joint of the tarsal joint, we call it a capped hock. This is a capped hook in a dog, and this is a capped hook in a horse, which is the calcaneal bursitis. If there is a rupture of the Achilles tendon and the gastrocnemius muscle, it's very characteristic. We can see it's a dropping of the tarsal. The tarsal is dropped. Sometimes it's even sometimes touching the ground because the Achilles tendon up there or the gastrocnemius muscle up there is torn or ruptured. Of course, paralysis is unmissable. The animal is dragging one or both of the hind limbs with lack of tone, literally just dragging it behind them. It most commonly, if it's dragging like that, it's a spine problem. It's a problem in the spinal cord itself, either as a disc or other reason or other cause for neurological manifestation. Sciatic nerve injury can be manifested as partial or temporary paralysis, sometimes complete paralysis. It's usually unilateral instead of bilateral. For instance, this German Shepherd has one leg is a problem and the other leg is just weight bearing. So the one paralyzed leg most commonly indicate it's a sciatic. Rather than both of the legs are paralyzed, in that case, it's more of a spine issue than a sciatic nerve issue. And it's a cool thing I added to say. So in Dachshund breed, the Wiener Dog Dachshund breed is predisposed to back injury due to their elongated body. And when that happens, the dog on wheel that has been fitted in with a wheel as a prosthetic helps them move and basically have a better quality of life. Asymmetry, when we move up towards the gluteus region, asymmetry is another good indication. Is it swollen right here? So it's an acute injury of the muscle, or we're gonna see in a case what most common reason, mostly in horses, in the gluteal muscle swelling in there, or it's atrophied, there is atrophy. Again, there is asymmetry, this side is lower and more atrophied than this one. So it's an indication of a chronic problem, usually around the hip region in there. My question here for you, do you think the right side is atrophied or the left side is swollen? Okay, so to put you out of misery, the left side is abnormally swollen because it's when we did an exploratory, first of all, it was hot, it was fluctuating, and had a little bit of an opening in it. To give you a hint, it was an abscess. When a exploratory puncture or basically stab incision with a scalpel being made in this swollen area, a water feature, a fountain of pus exploded out of these bull horses' gluteus area. What do you think the most common cause of this abscess is, particularly in the gluteus area? It's injection, injecting with a contaminated needle, or even sometimes part of the needle got broken, left in there. So it caused abscess in the gluteus region in the horse. So happy to receive any questions from you. Put it in the comment section as you wish. And I have a small quiz for you as well. So what's your diagnosis for this little puppy? Oh, I'll give you 3 seconds. All right, yes, it's knuckling over with varus as well. So it's angular limb deformity in both of the forelimb, presented as knuckling over with varus. What's your diagnosis for this horse? Correct? It's olecranon bursitis or capped elbow. What's your diagnosis for this dog? It's dead degree of lameness or carrying a leg, non-weight bearing on the right forelimb. Based on the manifestation of it, we are not sure yet, but it's most likely caused by a fracture at the level of the radius ulna. Thank you so much for Thank you so much for your time, and we'll follow up with further talks and presentation on the topic. For now, if you have any question, put it down in the comment section. Bye.